It is pertinent that the goals and objectives of the National Health Insurance Scheme of the Universal Health Coverage are attained. A major contributory factor towards ensuring the attainment of these goals depends strongly on the public perception of the objectives of the scheme. One key stakeholder in the health insurance process that can help improve perception is the health maintenance organizations. They play an integral role as the bridge between the scheme and providers. They synergize the efforts of the National Health Insurance Scheme in providing optimal healthcare service delivery to every Nigerian. The involvement of the HMO in the operations of the NHIS is our subject in this episode of the program. Stay tuned as we bring you details. My name is Aisha Muhammad Ahmed, your anchor. I will be back shortly.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS.
As part of its responsibilities towards ensuring universal health coverage, the National Health Insurance Scheme has organized a workshop for stakeholders in the health sector in Kwara State. Participants were drawn from the healthcare sector and collaborating agencies in the state. The workshop was targeted at improving the performance of the State Oversight Committee of the Basic Healthcare Provision Fund. Speaking at the event, the zonal coordinator in charge of Kwara State, Emmanuel Laja, urged participants to be attentive to ensure maximum benefit from the national funding system. Also speaking at the event, Abubakar Ayinla, Permanent Secretary, Kwara State Ministry of Health, said that the leadership of Abdurrahman Abdulrazak has fully aligned the state healthcare with the tenets of the Basic Healthcare Provision Fund for the attainment of universal health coverage. The Director General, Plateau State Contributory Healthcare Management Agency, Dr. Fabong Jem Tang, has called on citizens of Plateau State to demand for premium health insurance scheme from their representatives. He was speaking during an interface with the media on securing community sustainability in Jos, Plateau State. Dr. Fabong said the gesture will help in addressing a lot of diseases ravaging rural communities and also help in the attainment of universal health coverage. He further noted efforts to ensure that communities key into the insurance scheme to enable them to benefit from it and assured them of maximum and efficient services.
The program is easy access to healthcare for all. The health maintenance organizations play the role of a catalyst in the National Health Insurance Scheme. They ensure that healthcare facilities deliver services in accordance with NHIS standards and quality assurance process. They are in charge of giving referral codes to enrollees to access secondary care and remit funds to the hospitals, among other functions. Our next segment, Issues Around the NHIS, will bring you more details about the HMO as the program unfolds. Do keep watching.
Easy access to quality healthcare for all. NHIS.
The NHIS is the foremost agency in implementing social health insurance in Nigeria. It is intended to be the veritable vehicle through which Nigeria can attain universal health coverage. The scheme maintains a tripartite relationship with healthcare facilities and health maintenance organizations to see to the fulfillment of its mandate. The Health Maintenance Organization is a key stakeholder under the scheme. They carry out certain roles, but unlike the healthcare facilities, they do not interface directly with enrollees. The health maintenance organizations serve as middlemen for NHIS. They purchase care on behalf of the scheme.
The HMOs are the people who really do what we call purchasing of care. They purchase for us. They are just doing the work for us, doing the purchasing. So a lot of those roles that have to do with health purchasing, we do them, are done through HMO, but that's what the NHIS law says. All right. So we pay. What we do, there's what we call global capitation. So based on the capitation is per capita, that's per individual covered. So we release that money to the HMOs in advance. We are giving them quarterly. So when we give them that quarterly, we give them the list of enrollees per hospital according to all the hospitals that have the HMO, where we have our enrollees under every HMO. So that's how we get it. And then it is now the HMOs that transmit the list to the hospitals or health facilities.
There are requirements expected of health maintenance organizations before they come on board the health insurance ecosystem.
For HMOs, we have a requirement for HMOs. They must be registered with the Corporate Affairs Commission. They must set up a good office, meet all the regulatory requirements for setting it up. And then we also assess them. After they've submitted their applications, they've gone through all that, we assess them, we rate them based on governance structures, call center, personnel, and all that. And then we give accreditation to them.
As they come on board, their compliance is also monitored by the Standards and Quality Assurance Department of the scheme.
I've spoken about quality assurance. That is a routine way of monitoring of both the healthcare facilities and the HMOs. For HMOs, we also require that they give us other information like referral statistics, encounter statistics, and all that data based on all this, so that we're able to assess and see how far we are going. So we have many ways of monitoring through the state offices. For the healthcare facilities, the quality assurance are done routinely, and we follow up with meetings. There are stakeholder meetings that we call them, and we discuss most current trends in the scheme and get feedback from them and all that.
But who exactly is the health maintenance organization in the business of health insurance?
Health Maintenance Organization, otherwise called HMO, is the foot soldier in the provision of healthcare in Nigeria. You need HMO to ensure the provision of the much needed quality of care to the enrollees. Health insurance is tripartite. You need the regulator up there, that's the National Health Insurance Scheme, then the players, that is the Health Maintenance Organization, then of course the healthcare provider at the other side, who provides the much needed healthcare, that is the hospitals, the clinics, the maternity homes, the primary healthcare centers, the laboratories, the pharmacies, and all this and all that. Then, of course, the enrollees, who is the beneficiary of the scheme.
As key stakeholders, HMOs play specific roles under the NHIS arrangement.
The HMO are more or less the health auditors, because I think it's important for me to clearly clarify at this point the fact that before the advent of health insurance in this country, nobody was looking over the shoulders of the healthcare providers. They do whatever they wanted to do, and they get away with it. And that could also be responsible, whichever way you look at it, the systematic resistance of the HMOs by the healthcare providers, because they have been so used to not being questioned or queried by whatever they do in terms of service provision. But in this day and age, we have the HMO now asking questions, writing reports. Look, HMOs and enrollees they have the liberty and they have every right to report. The HMOs are like the police in the healthcare space, whereby as a provider, either at the primary, secondary, or tertiary level, should anything go wrong, you have somebody to call. That's the responsibility of the HMO.
The HMOs have a lot of roles. Number one, prompt payment of capitations to the HCPs, fee for service, continuous sensitization of the enrollees to know their rights. They also do monitoring and evaluation, like I've earlier mentioned, and they also do quality assurance. They are also saddled with the responsibility of issuing the PA codes, that is the referral and also the authorization code for enrollees to access care at the particular point of service.
The Health Maintenance Organization maintains a cordial relationship with the scheme, as well as healthcare providers and enrollees.
NHIS also regulates all the providers, both private and public. So HMOs must look at all those providers, all the healthcare providers, and see that they are offering quality service. So if anybody goes to a hospital and anybody has any problem, you don't need to quarrel with them. Just call your HMO. When you call your HMO, HMO will take it up so that you get customer satisfaction. So the HMO is to give you customer satisfaction, is to make sure that the hospital does not cheat you and is giving you quality care. And HMO is also there to make sure that the NHIS pays all the providers. So we monitor whatever money is due for those providers are given to them so that they can continue the service. So you see that the three of us, NHIS, HMO, providers, and the enrollees are going around in a circle.
That is the relationship. NHIS has to oversee the affairs of HMOs to make sure the HMOs are paying the facilities when due. You understand? And any problem that crosses between facilities and HMOs, it is NHIS that's intervening. HMO responsibility is to make sure they get service. They make sure they get service. It's like a quality assurance responsibility. You understand? So at the end of every quarter, there is to be a kind of accreditation. Accreditation in the sense that the NHIS will go through the books of HMOs to find out how many lives they have. Having done that, it has to also look at what are the challenges so far encountered by the HMOs in relation to facilities. Facilities usually check their grievances to NHIS. NHIS in turn call the two parties together at their table to sort out the problems.
As stakeholders, HMOs laud the new reforms taking place within the scheme, which improves efficiency.
This engagement is the most detailed and involved I have ever been part of, and have been active in this industry for more than 2 decades.
For us, it's a very good thing. It's good that we are all informed. It's good that there's a regulatory guidance in what ought to be done.
I think it is a very good initiative in a good step, in a good direction, that will be able to afford NHIS the new place in the industry.
Welcome back. With the Health Insurance Under One Roof initiative, state health insurance agencies are partners with the National Health Insurance Scheme in the journey towards universal health coverage. Today on our Stakeholder segment, we'll bring you an interview with Dr. Simeon Onyemachi, Executive Secretary, Anambra State Health Insurance Agency. Dr. Simeon says the Health Insurance Under One Roof vehicle will foster the attainment of universal health coverage.
in the context of that, you now realize that there is a destination, which is universal health coverage for Nigeria as a country, and then there are actors who should do that. And then the vehicle itself that should take us to that destination called universal health coverage was now coined by Professor Mohamed Nasir when he came in to say, let us galvanize all of the critical stakeholders that will take us on this journey towards our destination of universal health coverage. Therefore, in a cascade that looks like a house, okay, at the roof, you have the National Health Insurance Scheme coordinating, and then the state social health insurance schemes at the not lintel, maybe you talk about the parapet area, and then you now have pillars that will represent the struts that are holding the building, different strategic partners, and towards the base of it, you now have those truly who are implementing the scheme, talking about healthcare providers, international donor organizations that are supporting, and then ultimately the enrollees who are the beneficiaries. Okay, looking at the supply side, the demand side of health insurance, and then the regulators, both at the states, which is subnational levels, and then the national level, to bring all of these stakeholders together to ensure that we are all in one vehicle, discussing issues, coming up with policy briefs, panel beating all of this to see how we can successfully navigate Nigeria from the point of disjointedness towards the destination, which is universal health coverage. So
he speaks more on the synergy between NHIS and state health insurance agencies.
Because we are trying now with Professor Sambo's administration to do what we call it insurance under one roof, that relationship, which used to be non-existent, is now beginning to gel, where we have regular meetings, okay, various interactions through the quarterly review meetings that we have with our forum of CEOs of health insurance schemes in the country. Okay, you see that through those kind of relationships, we get to share experiences, we get to have capacity building opportunities, and then if there are opportunities within the federal government's purview that the various states can latch onto, then it is espoused to us, and then we latch onto such for the betterment of our people.
Dr. Simeon says the Basic Healthcare Provision Fund has really improved cooperation between both schemes.
With the Basic Healthcare Provision Fund, you have a marriage that is not that of convenience, which the marriage is practically inevitable, because there is a creation that says 45% of the fund will go to the National Primary Healthcare Development Agency gateway, 50% to the National Health Insurance Scheme gateway, and then the subnational levels, the state health insurance schemes, will administer that fund on behalf of the National Health Insurance Scheme in the various states. So you now realize that with this kind of creation, like Basic Healthcare Provision Fund, that relationship becomes even stronger. So we collaborate actively a lot on ensuring that our people get the best, and we truly get to change the narrative. Yeah.
How do state health insurance agencies operate in the area of dispensing drugs to enrollees?
What we do in our scheme to ensure that there is no out-of-pocket, forgive me, both out-of-pocket health expenditure, and to also avoid out-of-stock syndrome, which has been the bane of health insurance in Nigeria. Okay, I cannot have health insurance, and then I get to the facilities and I'm told there are no drugs. Why did I get a plan? So to avoid that in our own state, what we have done is to say, select any facility you want to go to access care. But when you have need for secondary services, when you finish seeing the consultants, then we have accredited community pharmacies across the entire state. Okay, for us, it's a unique feature. We have standalone pharmaceutical outlets where we have customized prescription sheets. So our enrollees have these prescription sheets, ASHIA, Anambra State Health Insurance Agency, ASHIA, customized prescription sheets. You take it to those community pharmacies and they fill your drugs. Because for them, that is the only way they get paid from the scheme.
Dr. Simeon Oyemachi speaks further on the extra efforts put in place by Anambra State Health Insurance Agency to increase coverage.
For informal sector, innovative healthcare financing in this country, through the help of the team, we work together to what we call adoption model, okay? In our adoption model, we encourage people who are philanthropic in nature to pay health insurance premium for others, okay? And with that, we have individuals paying for over 1,000 lives in the state, 100, 200, 500 as the case may be. Once you are adopting people into the scheme and the number is over 10, they don't move. ASHIA moves. That's the unique thing we do. You don't have to come to us. Once you pay money for adoption, we send our staff who are in the offices very close to where you are adopting from, and they come to the a central location and enroll the people there. So that way we have made enrollment very easy. And only recently also we have done mobile health insurance, the first of its kind, okay? In the past it was tinkered with in the country and then we stopped it. But in Anambra State we have successfully started it and it's working.
He speaks on some of the challenges faced by state health agencies while also calling on the NHIS leadership to support agencies struggling to take off.
I will say that there are states, okay, within our forum of CEOs of health insurance schemes in Nigeria, not all our states are at the same level. It will surprise you that there are certain states as noble as this whole idea of having state social health insurance schemes are. There are states in Nigeria that are yet to kick off. And it's not because these states are poor. Okay? I would want to see Professor Sambu lead the charge to help the country to go on advocacy to those chief executives. Okay? To really speak with them. Because there's a limit to what your staff who works for you can say to you. When we begin to have such kind of visits, when we begin to have constant engagement with the Nigeria Governors Forum, for instance, to show reasons why health insurance is the way to go, when we begin to do massive sensitization of the population to understand that, look, health insurance is the better option for you.
That was Dr. Simeon Oyemachi, Executive Secretary, Anambra State Health Insurance Agency, sharing his thoughts on issues surrounding health insurance operations. Up next, your questions answered. Do stay tuned.
Where do I register? How can I get enrolled?
How can I get enrolled? How can I get enrolled?
Question: what is the giftship program?
It is supposed to be an all-encompassing program that will cover G group of people, I individual, and F family, who are not employed within the formal sector, but they are either employees of the informal sector or they are self-employed, provided they are earning salaries, they are earning income, and that income is sufficient enough to pay premium and get into the social health insurance ecosystem.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
In Great Easy, we only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
And so, we draw the curtains on this week's episode of the program. We all have a responsibility to drive Nigeria towards attainment of universal health coverage by keying into the NHIS and letting more Nigerians know that they can enjoy social health insurance even in their different states across Nigeria. Find out how and get enrolled today. See you next week.